What is erythema nodosum? Let's dive into understanding this condition. Erythema nodosum, or EN for short, can sound a bit scary, but it's really just a skin condition. It's not something to be overly alarmed about. It causes painful, red bumps on your shins. These bumps can vary in size and may appear suddenly. These bumps are called nodules, and they can be tender to the touch. The tenderness can make walking or standing uncomfortable. EN is actually your body's way of reacting to something else going on. It can be triggered by a variety of factors. Think of it like your skin sending up a flare to signal a problem. This could be an infection, a reaction to medication, or even an underlying health condition. EN is more common in women than men. This gender difference is something researchers are still trying to fully understand. It can affect people of all ages, but it's most often seen in those between 20 and 40 years old. This age range is particularly susceptible for reasons that are not entirely clear. Don't worry though, most cases of EN clear up on their own within a few weeks. With proper care and rest, the symptoms can be managed effectively. Treatment often involves addressing the underlying cause, if known, and managing symptoms. This can include pain relief, anti-inflammatory medications, and sometimes bed rest. Regular follow-ups with your healthcare provider can help ensure that the condition is improving and to adjust treatment as needed. Remember, while EN can be uncomfortable, it is usually not a sign of a serious health issue. Unmasking the culprits, common causes of EN. So what triggers these skin flares? There are a few common culprits. Infections are a major one. Strep throat, for example, can sometimes lead to EN. Certain medications can also be the problem. Birth control pills and antibiotics are two examples. Autoimmune diseases are another potential cause. These diseases make your immune system attack your own body. Crohn's disease and sarcoidosis are two examples that can trigger EN. Sometimes, though, we never find the exact cause. But don't worry, we have ways to treat the symptoms and make you feel better. Recognizing the signs, symptoms of erythema nodosum. Erythema nodosum is hard to miss. The most obvious symptom is those telltale red bumps on your shins. They can be pretty tender to the touch. These bumps usually start out warm and firm, then over time they become flatter and change color. They might turn brownish or purplish. Along with the bumps, you might also feel a bit under the weather. Some people experience fever, fatigue, and joint pain. If you notice these symptoms, it's time to see your doctor. They can figure out what's going on and get you on the road to recovery. Getting to the bottom of it, diagnosing EN. Diagnosing erythema nodosum is like solving a puzzle. Each piece of information helps to form a clearer picture of your health. Your doctor will start by asking about your medical history. This step is crucial as it provides context and background to your current condition. They'll want to know about any recent illnesses, medications you're taking, and any family history of similar conditions. This helps in identifying potential triggers or underlying causes. Next comes a physical exam. This allows the doctor to observe any visible symptoms and assess your overall health. Your doctor will carefully examine the nodules on your skin. These nodules are a key indicator of erythema nodosum. They'll check their size, shape, color, and location. This detailed examination helps in understanding the severity and progression of the condition. To get a clearer picture, your doctor might order some tests. These tests can provide additional information that isn't visible during a physical exam. A simple blood test can check for signs of infection or inflammation. These are common factors that can contribute to erythema nodosum. In some cases, they may also recommend a skin biopsy. This is especially useful if the diagnosis is still uncertain after initial tests. This involves taking a small sample of skin tissue to examine under a microscope. The biopsy can reveal specific changes in the skin that are characteristic of erythema nodosum. Don't worry, it's a quick and relatively painless procedure. Most patients find it to be a minor inconvenience, and it can provide valuable information for your diagnosis and treatment plan. Tackling the issue, treatment approaches for EN. Treating erythema nodosum involves a two-pronged approach. First, we need to address the underlying cause. If an infection is the culprit, antibiotics might be prescribed. For autoimmune diseases, your doctor will recommend specific medications to manage the condition. Second, we can provide relief from the uncomfortable symptoms. Over-the-counter pain relievers like ibuprofen or naproxen can help reduce pain and inflammation. Your doctor might also suggest cool compresses or elevation to ease discomfort. In some cases, prescription medications, such as corticosteroids, might be necessary to reduce inflammation and speed up healing. Looking ahead, prognosis and recurrence of erythema nodosum. The good news is that erythema nodosum usually clears up on its own within a few weeks. With proper treatment of the underlying cause, the nodules should disappear completely. However, there's a chance of EN coming back. It's important to manage any underlying conditions to minimize the risk of recurrence. If you experience any new symptoms or if your EN returns, don't hesitate to contact your doctor. They can assess the situation and adjust your treatment plan as needed. Remember, early detection and management are key to preventing complications and maintaining your skin health. Pathophysiology, a deeper dive into EN's mechanisms. Let's delve a little deeper into the science behind erythema nodosum, commonly referred to as EN. EN is what we call a hypersensitivity reaction, which means it's an exaggerated response by the immune system. It's basically your immune system going into overdrive, reacting to stimuli that it perceives as threats. When triggered by an infection, medication, or an underlying condition, your immune system releases inflammatory chemicals, known as cytokines. These chemicals cause the small blood vessels in your skin to become inflamed and leak, leading to swelling and redness. This inflammatory response leads to the formation of the characteristic red, painful nodules that are often seen on the shins and other parts of the body. While we have a good understanding of the general mechanisms behind EN, the exact pathways and triggers are still being investigated by scientists. Ongoing research is helping us develop more targeted and effective treatments for this condition, aiming to reduce symptoms and improve patient quality of life. By understanding the specific immune pathways involved, researchers hope to create therapies that can precisely target the overactive immune response without compromising the body's ability to fight off real threats. Collaboration among researchers, clinicians, and patients is crucial in advancing our knowledge and treatment options for EN. With continued efforts, we are optimistic about the future of managing and potentially curing erythema nodosum. Beyond the usual suspects' additional causes of EN, we've already discussed the common culprits behind erythema nodosum, but there are some less common triggers to be aware of. Pregnancy, for example, can sometimes lead to EN, particularly during the second or third trimester. Certain cancers, such as lymphoma and leukemia, have also been linked to EN. Additionally, some environmental factors, such as exposure to certain chemicals or medications, can trigger EN in susceptible individuals. It's important to be aware of these potential triggers and discuss any concerns you may have with your healthcare provider. Complications. When erythema nodosum takes a turn. While most cases of erythema nodosum resolve without any lasting problems, complications can occasionally arise. One potential complication is ulceration of the nodules. This can happen if the nodules become infected or irritated. Ulceration can lead to pain, bleeding, and scarring. In rare cases, EN can be associated with more serious underlying conditions, such as tuberculosis or Behçet's disease. These conditions require prompt diagnosis and treatment to prevent long-term health problems. It's crucial to seek medical attention if your EN symptoms worsen or if you experience any unusual symptoms. Shielding yourself, prevention and management of EN. While it's not always possible to prevent erythema nodosum, there are steps you can take to minimize your risk. If you know you're prone to EN, especially if it's linked to an underlying condition, managing that condition effectively is key. This might involve taking medications as prescribed, making lifestyle modifications, or attending regular checkups with your doctor. Additionally, practicing good hygiene, such as frequent hand washing, can help reduce your risk of infections that can trigger EN. If you're prescribed antibiotics, it's crucial to complete the full course as directed, even if you start to feel better before finishing the medication. The last word, your skin's advocate. Erythema nodosum can be a concerning condition, but it's important to remember that it's treatable and usually resolves within a few weeks. By understanding the causes, symptoms, and treatment options, you can be proactive in managing your health and seeking prompt medical attention when necessary. Remember, you are your own best advocate when it comes to your health. Don't hesitate to ask your doctor questions, voice your concerns, and stay informed about your condition. Together, you and your healthcare provider can navigate the world of erythema nodosum and keep your skin healthy and happy.